Hello and welcome. Today, we'll be discussing ureteral stricture, a condition that can significantly impact kidney function and overall health. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Ureteral strictures occur when the ureter, the tube that carries urine from the kidney to the bladder, narrows. This narrowing can be caused by a variety of factors. One common cause is scarring from previous surgeries, such as ureteroscopy or other procedures involving the urinary tract. Trauma to the abdomen or pelvis can also lead to stricture formation. Other potential causes include infections, such as tuberculosis, inflammatory conditions like retroperitoneal fibrosis, congenital abnormalities present from birth, and even, in rare cases, tumors that press on or invade the ureter. When a ureteral stricture develops, it obstructs the normal flow of urine. This obstruction leads to a backup of urine into the kidney, a condition known as hydronephrosis. Prolonged hydronephrosis can damage the kidney, leading to impaired kidney function and potentially even kidney failure. The increased pressure can also contribute to infection as stagnant urine provides a breeding ground for bacteria. Essentially, the stricture acts like a dam, impeding the natural drainage system and creating a potentially harmful backflow. Ureteral strictures can affect individuals of all ages, but certain groups may be at higher risk. People who have undergone previous urological surgeries are more susceptible, as are those with a history of kidney stones, infections, or inflammatory conditions. The incidence of ureteral strictures can vary depending on the underlying cause and the population studied. While precise numbers are difficult to pinpoint, understanding the risk factors can help healthcare providers identify and manage potential cases more effectively. The signs and symptoms of ureteral stricture can vary depending on the severity and location of the narrowing. Some individuals may experience no symptoms at all, especially if the stricture is mild. However, as the obstruction worsens, common symptoms include flank pain, which is pain in the side or back, urinary tract infections or UTIs, blood in the urine, known as hematuria, frequent urination, painful urination, and in severe cases, nausea and vomiting due to kidney dysfunction. If you're experiencing any of these symptoms, it's important to consult with a healthcare professional for proper evaluation. Diagnosing a ureteral stricture typically involves a combination of imaging studies and other diagnostic tests. A common initial test is an ultrasound, which can detect hydronephrosis, the swelling of the kidney due to urine backup. A CT scan with contrast is often used to visualize the ureter and identify the location and extent of the stricture. A retrograde pyelogram, where dye is injected into the ureter through the bladder, can also provide detailed images. In some cases, a ureteroscopy, where a small camera is inserted into the ureter, may be performed to directly visualize the stricture and obtain a biopsy if necessary. Ureteral strictures can be classified based on their length, location, and the degree of obstruction they cause. Strictures can be short or long, located in the upper, middle, or lower ureter, and can cause partial or complete blockage. The type of stricture influences the choice of treatment. For example, short strictures may be amenable to endoscopic treatment, while longer strictures might require more invasive surgical approaches. Treatment for ureteral strictures aims to relieve the obstruction and restore normal urine flow, protecting kidney function. Treatment options range from minimally invasive procedures to open surgery, depending on the characteristics of the stricture. Endoscopic treatments include balloon dilation, where a balloon is inflated within the stricture to widen it, and ureterotomy, where the stricture is cut open using a laser or other instrument. In some cases, a stent, which is a small tube, may be placed in the ureter to keep it open. For longer or more complex strictures, surgical reconstruction, such as ureterostomy, where the affected portion of the ureter is removed and the remaining ends are reconnected, or ureteral reimplantation, where the ureter is reconnected to the bladder in a different location, may be necessary. Robotic-assisted surgery is becoming increasingly common for these procedures, offering minimally invasive advantages. While it's not always possible to prevent ureteral strictures, certain measures can help reduce the risk. Prompt treatment of urinary tract infections can prevent inflammation and scarring. Minimizing trauma to the abdomen and pelvis can also help. When undergoing urological procedures, choosing experienced surgeons and following post-operative instructions carefully can help prevent iatrogenic or procedure-related strictures. Managing underlying inflammatory conditions can also play a preventative role. The prognosis for ureteral stricture depends on several factors, including the underlying cause, the length and location of the stricture, and the chosen treatment method. With appropriate treatment, most individuals can achieve long, term relief from obstruction and maintain good kidney function. However, strictures can sometimes recur, requiring further intervention. Recent advances in surgical techniques, such as robotic surgery and tissue engineering, are offering promising new approaches for treating complex ureteral strictures and improving long-term outcomes. Researchers are also investigating new ways to prevent stricture formation, such as using anti-scarring medications.